The first question people ask when there's a cancer diagnosis is, how do we treat it? As you can see from the 109th annual meeting in Boston, we can find cancer of the breast and treat it with image guidance using ultrasound and MRI with focal therapies. Dr. Behrens is now the current chair of research for the top university in the Netherlands. The French in 1999 developed contrast ultrasound, which shows the tumor vessels even better. The point they made is a tumor can enlarge as it is successfully treated due to the presence of cystic degeneration. So as it dies, it swells. So there must be a better way to follow, is the treatment working? So there's focal ultrasound, ablation with freezing, there are antioxidants, there's hormone, there's radiation, which takes 2 to 6 months, and other studies. So here we see the cancer. It's dark on the ultrasound, and it's vascular. We can measure the tumor vascularity, and also with the scan, we see it's already metastasized. So we do everything staging with non-invasive imaging, non-biopsy. Back to biopsy. Where do you biopsy? Here's the mass. You put it here and get a good biopsy report, or do you put it here and said that you got dead cells, repeat the biopsy. So there are false positives, not only with biopsies and false negatives with biopsies, there are false positives, PET scans. Here's a silicone in a lymph node from cosmetic surgery. Everybody's getting the vaccine now, so they're developing inflamed lymph nodes, which can simulate a cancer, or a scar, a healing scar can simulate a cancer on a PET scan. Here's a PET scan which showed 3 nodes, but only one was positive with a 36% vessel density. This is the measure we use. This is the quantitative marker that shows how aggressive it is, because when the 36 goes down to 2%, treatment is working. When it goes up to 55%, treatment is failing, start a different treatment. Here's an advanced digital PET CT showing one of the nodes. So we have lots of tools in our armamentarium to find and to treat cancers. Here's a metastatic rib focus. And again, we can see that the tumor is high grade because there's a high vessel density, and this is used to follow treatment. False positives, a rib fracture will show up on a PET CT scan as a cancer focus or a rib metastasis. This was thought to be benign keloid in this post-op area, and the mass by the sternum is actually pitting and eroding into the sternal bone, which you can see on the 6-centimeter tumor that's just beneath the skin, and it's breaking into the sternal bone at 2 points. Another lump, just a fatty tumor. The skin, that black line is simply the epidermis. So we have fantastic imaging. All right, we have a mass here, a mass here. This mass is a granuloma from the suture, and this is a fat necrosis with calcification, both benign. Here's a axillary suture fibrosis. This was missed by all imaging, and the patient kept pointing on, this is where I hurt. So we put the probe on, and this is a suture fibrosis. Okay, here's a good case. Here's a mass. You see the skin is abnormal. What to do? We did a thermogram, which showed it's highly positive. It's red here and it's blue here. So the red is tumor vascularity. Same patient, this is the mass. Notice how the mass is eating into the bottom of the epidermis. So it changes it from a stage 1 to a stage 2 because it's spread to the skin. Now, this looks like a dense breast, but it isn't. This looks like a not dense breast, but it is, because here's the cancer. It's a huge 6-millimeter cancer on the outside of the breast. And what does it look like with ultrasound? So is this a rash, a red breast? No. This is the epidermis again, and this is a 5-millimeter to 6-millimeter epidermal lymphatic cancer. Rare, it's an inflammatory breast cancer. Rare, but this is the best way to find it, and sometimes the only way. Again, is it an inflammatory cancer or an allergic reaction? Again, sonogram is 5.2 millimeters depth when it should be 1.2 with the allergy. Okay, radiation edema. Is there a cancer here or not? Is it just scarring? You can see it's simply scarring. This is the scar in the tissue. Now, how do we screen dense breast now? We know that mammography doesn't work for everyone. Indeed, there's a almost 50% chance of missing it in women with dense breasts. So here's the ultrasound showing a large black area, which is the cancer. The mammogram really shows a tiny area, and we use the ABUS, automated breast ultrasound, ABUS. This is a new way to screen. So this is what a benign lymph node looks like here and here. This is what a malignant lymph node looks like. It's all black inside, and this is the rest of the breast tissue. So not only does this find the tumor in the breast, but it stages the cancer if it's spread. This is a benign fatty tumor in the breast. And since the nipple and skin can be involved, we also use optical systems that see the microanatomy and see if the tumor has invaded the nipple tissue or the skin. What causes breast cancer risk? Well, chemicals, as we're approaching 9/11 with all the toxins in the air, the chemicals increase the risk of breast cancer in American women. How do we find that? Well, with looking at the skin, this is the skin. This is a intradermal white area, it's a plaque, and the 4D scan shows multiple plaques. So this is uranium toxin, which is in the skin. You can find it and measure it. Let me leave you with the World Conference showing that angiogenesis and vascularity are the key to finding cancer progression and seeing if the validated anti-cancer treatment works. Here's something common. This is a reactive lymph node from COVID. This is a metastatic lymph node. Notice the difference. Tumor vessels on the outside penetrating, and this is benign inflammatory vessels. How does the anatomic staging work? This recent study shows that it's not so great. We need better staging. Here's an example. Here's a mass under the arm and a patient receiving biologics. So they thought it was a fatty tumor. No, it's a lymphoma. And notice this is connected with a vascular pedicle to the big subclavian artery. So you put a needle in here, it bleeds. This was courtesy from one of the heads of the Ultrasound Society in Europe. There's a mass here. Notice the right side, this white line and blue line show that it's a soft tissue area. And on the left side, the white line is thicker, and now it's red, which shows that it's inflammatory tissue. So this is a case of benign fasciitis, which was treated with steroids instead of a metastatic tumor. So basically, this is what the world is doing, and we can be doing it here with adopting all the new imaging technologies.